between 11:30 and 12. Okay. I would like to get through breath sounds and orthotics and start goniometry and manual muscle testing. Okay. Sounds good. So you guys all have sheets on breath sounds, and to study from it, page 448 and 449, big red, is going to give you all of the information that you need. I know. But just think, you won't have to bring them back in here after this. You're done. So I had these all in my little wheelie thing. In my little wheel thing. You should have seen me like trying to get it into my car. I was like, throwing it up in there. Okay. All right. So your auscultation areas, I doubt that they're going to ask you about that. But they may ask you about different questions about upper lobes, lower lobes, that kind of thing. Okay. So auscultation, we know, is you're just listening to the lungs. You're listening to how the air goes through the lungs, correct?
Yes.
Okay. And you're listening for what it sounds like and what the intensity is. So if it's normal, I wrote down there for you, it's vesicular, and you just hear like a soft rustling sound. You guys remember listening to each other's breath?
We never did. We were supposed to, and there was the hurricane, and then we never.
Oh, okay. Did I not give you one? Then you didn't get the other one either. So hold on a second. So we did bring in, and I don't know where they went to, stethoscopes. So why don't we do that right now? Okay. So this is what they do at the doctor's office. Right? Here, Stephen.
Thank you.
You're welcome. There was a whole box of stethoscopes. There they are, PTA stethoscopes. Okay. Are they in here? These are just blood pressure cuffs. No, they're not. Those are stethoscopes parts.
Yeah, but build your own.
Well, that sucks.
Yeah, they're all here.
Are they? Well, why didn't you help in the beginning?
Oh, that's right.
So everybody grab a stethoscope.
Remember, this is not a birthing mannequin.
It's a birthing mannequin?
I wondered about that. So it's not, what is it? It's just, is that the blood pressure cuffs?
Don't you know this is their facility? We're just living in it. Yeah, we rent.
What are you talking about? So page 449, okay, if you go to the posterior view, all right, you're going to be able to see the upper lung. You're going to be able to listen to where you can listen to the upper lungs, okay, and I would probably just start there, all right. So it's going to be right around the top of the spine of the scapula. So what you normally hear is it just sounds like a rustling sound. Like, have you ever watched those scary movies and you hear the breathing and they're like, but there's no like vibration in there. It's just like, that's what you should hear. Not as intense, but that's what you should hear. That's what you want to hear, okay? And then it gets silent for a second after everything gets blown out. Do you guys hear it? Just like a... Yeah, so if you purse your lips, breathe in, and then blow out, you just hear that soft rustling sound. Make sure as you breathe, if you don't give them the order, if you don't give them the instructions to take a deep breath in, and every time you go to the doctors, right, what do? Take a deep breath in and blow it out. Take a deep breath in. You're listening to your heart and blow it out.
I'm listening to see if these are even working.
Just, are they not working?
Is your heart not beating ever?
Are you dead?
Did you hear it?
Oh, I thought this one like switched. Get another one. Do you hear anything?
I can hear it. I push down on it when I tap it.
Okay. I don't think that's a very good one.
But my
It looks like you're missing a part.
my heart is dead.
You're missing a part of that. See how hers is? You're missing a part.
I know. That's just what was on.
Okay, so you guys hear that? Everybody sounds normal? Okay. So remember how the way that the lungs are, okay? You have your trunks, your trees, your bronchi, and then you have oh my God, little round things at the end. Uh-huh. Alveoli, thank you. So when it sounds like a little bit louder and a little bit more hollow, you guys aren't going to hear that because everybody's healthy here. That's what they call a bronchial sound. And then if Amber's stethoscope wasn't wrong, and literally she goes to listen every time, and she's very quiet and you can barely hear it, those are decreased breath sounds. Thank you, Andrew. You guys should be cleaning those off. All right. So you really get concerned when it gets into something called adventitious breath sounds, because that's when there's something wrong. Mm-hmm. So with cystic fibrosis, pulmonary edema, you're going to hear something called crackles, also called rales or rhonchi. And it's kind of a rustling sound, like a deeper rustling, I'm sorry, sound, okay? And when you hear wheezing, wheezing is from what? What pathology do people, asthma? So when people are having an asthma attack, do you know what it sounds like?
Yeah.
Yeah, that's wheezing.
And people wheeze at nighttime though when they're having trouble sometimes too, right?
I think they do when they're having trouble, like with sleep apnea. They might do it or something. Yeah, possibly.
If my neck is flexed that night, I'll like start wheezing,
Mm-hmm.
and I can hear the little whistles, and I'm like, "What the heck?" And then I move my neck, and I'm fine. I don't know what that's about.
So when before I came back, right at the beginning of the year, I ended up getting a respiratory virus. That's why I'm staying away from Amber, because it's like I've caught every possible virus that you can catch lately. So I'm trying to build up my immune system. But I would find myself, and I got really worried, and I ended up going to the urgent care, because when I would breathe in and then breathe out, I could hear the wheezing sound. So I was getting very worried that it was getting into my lungs, and it whistled a little bit, okay? And that's caused by decreased size of the airway causes it. So it's like you have a balloon, okay, you stretch the balloon, or you go ahead and let it slowly come out of that. All right, a smaller opening, if you're going to create a wheezing sound. So what do you think would cause wheezing? Obstructive, something, COPD. Yeah. Okay, so COPD is going to go ahead and constrict those for you. Does that help a little bit with the breath sounds? That's all that your exam book is really telling you need to know, by the way. They didn't get into listening areas. They didn't get into postural drainage. They didn't get into any of that kind of stuff in your score builders book. What'd you say? I know. But
So that's
I
really
would
it. Crackle and wheezing is what we're listening.
crackles and wheezing is the
There's more.
abnormal. I know. Rails, I've heard, which is like you usually hear when people are like dying. You know what I mean?
Like the that's not fun.
Not the final breath that you hear, but you kind of hear that. Yeah, RALES. Have you ever been around anybody who's been dying?
Yes.
Yeah, yeah, and you start to hear that. I remember when my mother-in-law was dying, I didn't want to tell my husband because I heard that sound and I was like, oh man, I don't want to tell him. And then the next day she was gone. So any questions on that? Don't get too involved in that because as I recall, they don't consider it like you need to know it. But I think a lot of the postural drainage, the percussions, all those kind of stuff is things that's being done really by respiratory therapy more now than we do it. So they're not considering it like a critical skill anymore, I don't think. Okay. All right. So that was everybody okay with that?
Yep.
I don't remember. Was that your question? That was your question that you sent in. Okay. Your question you sent in. All right.
But I also asked about the tests.
I have tests. Tests? Did you ask about tests? Okay. It's on there. So orthotics. Pull out your orthotic ones. Okay, so the general purpose of orthotics is to support, stabilize, improve function, correct deformities, and distribute pressure for relief on an area. All right. What would be an example you would use to support? Orthotics. A back brace. Do you ever see like people that do heavy lifting all the time? They wear the back brace. That would be for support, okay? What would be an example of a stability brace? TLSO could support as well as that's the turtle shell. Yeah, but it could also stabilize. Yes, but let's get out of the back.
AFO.
An AFO would do more of something else.
Oh.
What about around the knee? What about the knee with the uprights on the side to stabilize valgus or varus stress or to decrease extension or increase or stabilize with extension in case they're too unsteady and they have a lot of knee buckling. Okay. So wouldn't that give them more stability? Okay. So improve function, AFO. Yeah. Somebody's got foot drop. That's going to help. If you can go ahead and put them in an AFO, it'll definitely go ahead and help them when they're walking, right? How about correct deformities? A lot of like AFOs or just FOs, like foot orthoses. Like if somebody has like pes cavus, that you might go ahead and put an orthotic in their shoe, okay, to help with that when they're walking and stuff. How about distributed pressure for relief on an area? A cushion? That's not an orthotic. In the shoe. Yes, so you can do a lot of stuff with cushioning or orthotics in the shoes that might take pressure off of like the toes or a bunion or something like that. Okay, makes sense?
Yes.
So those are the general purpose of orthotics. So the function is to prevent deformity. Where might you see preventing deformity? Maybe in peds,
Like clubfoot.
clubfoot. Yep, yep. Maybe in peds you might see a little bit of that, or even like your um, scoliosis. Yep, the scoliosis braces, or maybe even like your toe walkers if you're trying to get them off of toe walking, possibly. Makes sense. How about proper alignment?
Like a shoe insert.
A shoe insert. Yep. You could do something at the knee too, correct? Knee braces. Oh, God. Yes, you could do something at the knee too for that. How about inhibiting tone? What do we talk about for inhibiting tone? So you have extension tone. You have extension synergy syndrome.
Oh, give more.
No, the give more is more for support. But what happens when you have extension synergy? Lower extremity extension synergy. Describe to me what that looks like. A little bit more detail. Where? Well, you have increased dorsiflexion, knee extension. Remember, increased dorsiflexion, increased knee extension, and increased hip extension. So, if you want to, can you walk easily when you're always in dorsiflexion? Not really. So you stretch that out and you work and you break that spasticity, right? Okay. Would you do that by quickly stretching them or would you do that by slowly stretching them? Slow stretch. That's going to decrease that tone. And then you want to keep them there. So what might help to keep them there? An AFO. Put them in an AFO and that'll help keep them there. Okay. So that would be an example of inhibiting tone. Okay. So it's not going to be, oh, I can get them into this brace and that's going to solve it. No, you're going to have to do something beforehand to break that tone and then put them in whatever you're going to put them in to inhibit it. Okay, coming back. Assist with weakness. AFO, give more. That would be the give more would be a good one. That would also be one where you're trying not to get, well, you're protecting against injury. Okay, because you're going to have more, if you have a glenohumeral subluxation, they're going to be in a lot of pain and you're going to have a lot more injury going on there. Okay. You could protect against injury with an AFO too, because if they have foot drop and they're dragging that foot, they're increase your chances of falling, right? You could protect against injury with a knee support brace, right? Because you don't want their knee to buckle. Okay. You could protect against injury with a full leg brace, the hip CAFO, couldn't you? Okay, because that'll help them to walk. All right, and assist with weakness as well. And then facilitate motion. What would be one that would facilitate motion that would be an orthotic?
Don't they have AFOs that are almost like spring assisted?
Mm-hmm.
Like this one calls it a toe off. Kind of different. Goes on top.
Yep.
Helps with the toe off.
Yep. Yeah. There are ones that are spring assisted, like you said. Okay. So that would definitely, if somebody didn't have, well, that's more of a prosthetic when you think about it. But if they do have the springs in the AFOs, okay.
For like nighttime braces that you can sleep in and just keep providing constant pressure into
into that. Yeah, exactly. Like for Achilles tendons or, oh my God, what's the other thing they put in? Oh God, my head just went. They call them night something though, but they do call them night something. Plantar fasciitis.
Mm.
They use them for plantar fasciitis too. All right. So you have your corset braces. The corset looks just like a corset. Everybody knows what a corset looks like. So it goes around the back, under the chest. Pull it tight. Okay. Kind of like the ABD binders wrap and Velcro. This doesn't. This has stays in it. It's like the old-fashioned corsets you see in old-fashioned movies. Okay.
Like the ones that Caitlin brought.
Yeah.
wore at Halloween.
Yeah. And then it laces up the back and you tighten it out the back. Okay.
Like the one I wore at Halloween.
Yeah. So that is going to give you support in the mid to low back. So you're going to decrease the pain. So if people have like bad stenosis going back there, okay, you're gonna increase pressure to keep them upright more, okay, to help with their posture. Yeah, it feels good. Doesn't it feel good? It's going to take a lot of the weight off of the intervertebral areas, intervertebral foramen. Okay. What is the only problem sometimes with wearing orthotics all the time? Muscle weakness. So if you take the pressure off, your abs don't have to work as much. Okay. So it might be something that they wear part of the time to help with the pain, to decrease their pain, but I wouldn't be exercising them in it. That's not going to do a good job. Long-term effects, you want to get those abs stronger. Halos. Do you remember what the halos look like? Frankenstein freaky things. Yeah. Do you guys remember what the halos look like? Halos, everybody? Yep, they sit around the top of their head. They kind of crank into their heads, come down with struts that sit over their shoulders. That is usually used after a cervical injury for spinal stability or cervical. I haven't seen it so much for like cervical surgery. They usually use like the hard braces that go underneath. I think those are Miami braces, they call them.
The halos with that.
More trauma. Yep, more trauma. Yep. Yep, Miami J brace or more of those hard braces that you see that go fit underneath here and then come over here. So they really can't, it limits their movement a lot after spinal surgery.
There's a kid in my school that had his senior year, he was on one of those all year. Philadelphia.
That's what I'm thinking. The Philadelphia collar. Sorry.
Miami, right?
Yep, the Philadelphia collar. Yep. So the coolest thing that I ever saw was I had a lady, she was probably in her early 30s and she had little kids. So in order not to scare her, she had one of the Philadelphia collars on. In order not to scare her kids off, she bedazzled her whole collar.
Aww.
Yeah. So it was pretty cool. So it made it look less scary. All right. Milwaukee orthosis for realignment for scoliosis. Your talar brace is a TLSO that limits trunk flexion and extension. But then a true TLSO is the clamshell that you see post-spinal surgery. Everybody remembers the clamshells, right? Patients hate them, don't they? They're not comfortable. They hate them. They usually can take them off in bed sometimes. They'll allow them to take it off when they're in bed, but they have to wear them all the time when they're out of bed. Okay. And a lot of times they'll be in that after they have, not really a laminectomy, but like, depends. I think, because they don't always use them. Like if they've had fractures and they've had to use something, okay, do a surgery, that's when they'll put them in them. But if they've done like a cage, just your regular fusion and cages around them, they usually don't put them in those. Unless they're concerned they won't be able to stay with their precautions.
We had a patient, inpatient, he had spinal metastasis, so
Mm-hmm.
he had those.
Yep. So that would make sense for that. I've seen them used a lot post MVAs. Okay, that they put people in those braces. And I've seen them like with people that they have got some dementia post-surgical that they don't want them bending over. And so what are usually your precautions? Bending, lifting, twisting. Yes. And is that usually on a laminectomy or is it on your fusions? On your fusions. Yeah. The laminectomy, they're just taking out some of the lamina, okay, in order to relieve the pressure. And it's very non-invasive as opposed to when they go ahead and do the whole spinal fusion, okay, or whatever they're fusing. And then your lumbosacral orthoses, that's Andrew had mentioned those, and we talked about those as back brace supports. People do heavy lifting, construction workers, somebody who's got a lot of low back pain, they will go ahead and put that on. Literally thought about doing that when my back went out. Yep. Yeah. Yep. Because it just helps to support your back, it protects it a little bit. So it decreases your pain, gives you support, but it also protects it a little bit. There's a million other ones out there. There's the SI belt, okay, that you people who have instability in their sacroiliac joint will go ahead and put this belt around there. That actually is what I ended up doing because it was in my SI. So I wore that a lot. All right, so then you can get into the foot. So in the book, all of these descriptions are in there. So while you guys, I did not fill out all of them for you. Why don't you go ahead and look them up? I think they're also in your exam book. And then we can talk about them a little bit. Take about 15 minutes to go ahead and do that. Okay? Where are your orthoses?
Orthotics runs on 1287.
Is it 1287 in Big Red? Okay. And then it's also in here somewhere.
You have an extra piece of
Did I not give that to you?
Yeah.
Oh, I'm so
I was
sorry.
double checking it too.
Did you get the breath ones?
Yeah, I did get those ones.
Oh,
I
I'm so
think those are-
sorry. Well, I was passing them out when you guys weren't here, so that messed me up a little bit. Yeah, I was going to say. So 128 and 129 score builders goes through everything. That is exactly in there. Okay. So take about 15 minutes, complete it. We'll go over it quickly. Okay. And I would try to use as little words as possible, okay, when you do it, so that you're not writing everything out, but it'll help you to remember, okay? Like heel lift. Obviously, it's going to be in the heel. It lifts it up, right? Height. So lifting up height in the shoe for pressure on the Achilles tendon. It's probably all that I would do. Now it says limits the effects of leg length discrepancy, but I don't think I would use that throughout it. So quiet. Oh. Bless you. Just shaking your head for Jackie. No, that's what
No, it's not this. Sorry, my mind's other things.
went somewhere else.
Yeah.
Okay. How you guys doing? If you're done in less than 15 minutes, let me know. Because it's only been like, not quite 10, 8. You're done. Those guys are almost done. Just looking, we're having our house painted. It's been very exciting compared to what it looked like, what it looks like now. Actually did 3 colors. So it was like this yellowish color. Here we go. You can see the back of it. Well, they had pressure washed it, so a lot of stuff came on. So they get
Okay.
that's what it looked like. So now, oops, I gotta go back over to. That's what the front looks like. We were pulling the stone in. It'll look much better.
Yeah, looks real good.
That looks much better. So now, and then they just did this trimming part here.
Yeah, no contrast.
Yeah, doesn't that look good? I like it. And then we did the gray up on the top with the roof.
Looks good.
Thank you. I picked those out. My husband's not allowed to pick out colors. He painted a wall one time 5 times, and we went back to the original color.
We're going back and forth on what colors we're going to have to be. We're building, so we have to make all those decisions.
Yeah, which is exhausting.
We're not even thinking about building yet, but all the what ifs right now are.
It also
Yeah.
depends on what type of house
It does.
colors go well with. Because I work in that field with my stepfather.
Mm-hmm.
Painting exterior houses and interior. So it really plays a big part of the type of house.
Exactly. Like I probably wouldn't have gone with those colors if we were in like a more modern house, but because we're pulling in the colors in the stone, and my husband has a monster garage that's got that same like dark color where the gables are. That's the color of his roof and trim. So we wanted to pull that in, and then it's like a terracotta browns color, and we didn't want to paint the house that color, so the kind of all goes together much better now. But looks warmer than that. I don't like yellow houses.
My girlfriend's leaning towards yellow because we're doing fire news. It's going to be all roof, all building.
Oh, that's cool. Yeah.
And she's like, I want to do yellow. We're going to look like we live in a banana.
I know.
SpongeBob's house.
So I was showing him this kind of is the color it was before. But yellow, it was this yellowish color. Oh,
Yeah,
sorry.
It's okay.
Ugly yellowish color.
That's usually how it always is from like the olden.
Yep. And this was all white. Like all of the gutters and everything were white. And so we were trying to pull it in with the, I got to go back. Yeah, so we have the stone. We match
Okay,
the colors to the stone.
Okay.
See?
Okay.
And the roof.
The stone goes with the sides of the little roof. I think that's what the gutters.
Yeah, the gutters.
So-
Yeah, and there is some actually. See the green? You
Yes,
can't really
that-
see it as much
Right, but
here, but like
it's in the
that you can
same
see it
palette.
better. Yeah.
So the door though,
The doors stay in white.
it's staying white.
We decided to leave it white. I know. We
And
actually,
especially with the bushes that you're trying to put in there, it's gonna just make it pop.
yeah, we got it. Yeah, and we're going ahead and changing the landscape. That'll get changed
Very
eventually.
nice.
But yeah, so then when they finished it,
It's not a
finishing it.
bad shade of green. That's actually pretty.
No, it's a sage
Pretty
green.
nice. Sage
Yeah.
green is very nice.
Yeah, so we went like the gold.
Goes well with the goldish beige color.
Mm-hmm.
Always goes good with that.
Yep. And then the dark color up top.
That's very nice. It always, those dark colors always goes good with like sage green and that color palette.
Yeah.
That's so nice. Okay.
Yeah.
I see you.
Yeah.
That's nice.
Yeah, we're excited.
Mm.
So I picked them out, and then I didn't know what I was going to do with them. You guys done? And then I went outside. I woke up, went outside, and I went, okay, I'm ready. Okay. So who wants to tell me about the knee, ankle, foot orthoses or a CAFO? Stephen.
Helps with proper alignment. Has two metal uprights from the shoe to the thigh.
Okay. So that's where the proper alignment comes in, right? Because remember, go back to your general purposes or your function and your function. Okay. So does that make sense to you guys to remember those? How about the Craig Scott CAFO? Andrew.
It is CAFO with the ability to stand with the posterior lean.
Okay. And that's more for paraplegics, right? For paras. Okay. So they need that support. Goes back to support, stability, right? So when you're studying these, their questions are going to be like, what's going to give you this such and such scenario? What would you do? This is what they have. What would you do? You have to think, how am I going to solve their issue? Do I need to look at it support wise, stability wise, improving their function, correcting their deformities? And what orthotics are going to go with that? Make sense? So it didn't go all the way out because we just don't have enough time to cover it. I mean, orthotics was a class in itself, as you guys recall. Okay. Hip, knee, ankle, foot orthosis. Raul.
So arrow consists of bilateral weakness with the hip joints and pelvic band, controls rotation of the hip abduction, adduction, and then also are used for patients with swing 2 and swing 3.
Okay, so what kind of patient are you going to use that with? And what does that solve as a general purpose? Is it distribute pressure relief? Yeah, weakness. And it's improving what? So it's assisting in weakness for the function. And what is it? It's improving function, right? And giving stability. So what kind of patient do we usually use that with? A hip CAFO. What might need a hip CAFO?
Incomplete.
Yes, an incomplete spinal cord injury. Yes. Okay, perfect. Perfect. All right. Karimar, my dear, reciprocating gait orthoses. Tell me about those.
So it's basically a hip CAFO with a cable system to help the lower extremity advance. So you shift to one side and the opposite side will advance.
Okay. So what does that do as a general purpose? What's it doing?
Assisting with gait.
Which is of those things we have marked up there. What are
Facilitate motion.
Yeah, improving function, and then the function is in facilitating motion. Yes. Okay. So yeah, definitely does that. It improves function and it facilitates motion. Okay, Jackie, what's a parapodium?
Standing frame that you can also sit, and it's more used in the pediatric population.
Okay, pediatric population, but then they just call them standing frames when you see them in the adult population. Okay, what is the general purpose of that? Of the 5, 1, 2, 3, 4, 5 that are up there that I told you about, is it supporting them?
Yeah.
Is it giving them stability? Yes. How about the function?
It's to ambulate them.
No, they're just standing.
Distribute pressure relief.
You could, but that wouldn't be your number one function of it. It's going to be more the support and the stability. You could say improving function a little bit, but they're not, because they are standing and not just sitting. Okay. But a big part of that is going to be assisting in the weakness, right? If it's somebody who can't stand, what is a secondary risk of somebody who is not putting any weight on their bones? Osteoporosis. Also, if you are trying to get them stronger and all they can do is sit and they can't stand on their own, are you strengthening them? No. Functionally, if you get them up into a standing frame, are you trying to work to make those muscles stronger? You are, by getting them up there, hopefully, a little bit. If you got them into a walking frame, so it's a standing frame and then they can actually ambulate in it, that would be a different story. That would help, and also help to do more function with it. So who might use a standing frame?
I saw it a lot in neuro.
Neuro patients a lot. CVA patients that might be too weak to stand on their own, they could do it. Okay. Maybe a TBI patient who has multiple other issues going on and they can't stand on their own, but if they're allowed to.
Why does it say pediatric?
Because they do use it strengthening wise with peds.
Okay, mine too. I use it. Someone with Down syndrome
Mm-hmm. Yep. Yeah. Yep. Okay. All right. Where are we? Okay, so heel wedge, we know that prevents hindfoot inversion or eversion, pes planus or pes cavus. So what is the purpose of your heel wedge? What is it doing? Look at those 5 I gave you, the general purpose. I want you to go back to that because that's what I want to keep this simple. Okay? Correct deformities. Yes, thank you. And what would the function of it would be? Proper alignment. Great. That was an easy one. All right. So Amber, tell me about a heel lift. What's a heel lift?
It's a placement in the heel of shoe. It's usually gel or plastic, and it's for leg discrepancy.
Okay. So are you going to be...
Correct deformity, proper alignment.
Okay. What else does it say in there? Achilles tendis for Achilles tendonitis. That is probably where you're going to see it more than a leg length discrepancy because you're really kind of not doing, I don't really like that thought of doing a heel lift. Really, if you were trying to do leg length discrepancy, I'd be putting in a full foot orthoses to make the shorter leg higher rather than making that person walk around on their toes. What's that going to do? If they're walking around more like this, it's going to throw their hips off. It's going to put more pressure on the metatarsal heads. It's going to put more pressure on their toes, right? I don't really like that description, but the Achilles tendonitis, it's going to take some pressure off of the Achilles tendonitis because people that walk in with severe Achilles tendonitis, I had a lady, severe Achilles tendonitis, both feet. She walked like this. You can't see me walking like that, and I'm not stepping up on that. But she walked on her toes like a toe walker because her Achilles tendon was too tight. I wouldn't have her wear that all the time, okay? But if you had a repair of the tendon and you didn't get it all completely stretched out, they would have to wear it to protect it, okay? But if you have it in there all the time, isn't it going to shorten that tendon? Yeah, so I'd be careful about how often it is. So, what is going to be the general purpose of that? Using a heel lift. Miss Amber?
To relieve the Achilles tendon.
Look at those 5. How come you guys aren't getting this concept? The top of the paper. Are you correcting a deformity? No. Are you distributing pressure for a relief of an area? Yes, you are. Okay, so what is the function? Are you facilitating motion? Not really. No. Are you protecting against injury? Yes, you are. Understand? Okay. See how those go back
Yes.
to that?
I wasn't looking at those ones over there.
Look at the ones up there.
I see them now.
Okay. All right. So heel cushion, Caitlin.
It helps to decrease pain, specifically from cranial spurs.
All right. So what is the general purpose of that? Pressure relief. And what is the function of it? Protect against injury is probably, yeah, because you're probably going to get some more, yeah, deformities kind of things going on there. Prevent a deformity. Okay, Stephen, we're back over to you. Heel cup.
So, heel cup, rigid insert, covers plantar surface of calcaneus, extending up all three sides. It provides some shock absorption for the heel.
Okay.
It helps stabilize the calcaneus.
Okay, so are you going to remember all that? No, it's a heel cup. So if you think of a heel cup, it's going to go ahead and be back there at the heel, right? All right. So what I would remember about that is heel shock absorption. This is all I would write down. Heel shock absorption, neutral, because it keeps the calcaneus in neutral, for spurs, and plantar fasciitis. That's it. That's all I'd write down. Just to remember that. So what is going to be the general purpose of this? Of those top 5? What is that heel cup doing?
Heel cup is distributing pressure relief.
It is distributing pressure relief, yes. And what is the function?
The function protects against injury? No. It prevents deformity?
More proper alignment. Okay. Stabilizes. It stabilizes. You've already got the injury going on because you've already got the heel spurs and stuff. Okay. So you're trying to keep it in proper alignment to, yeah, keep it in neutral. Okay. That's the key there. All right. Andrew, what about your metatarsal bar or pad?
So it is a flat bar that relieves metatarsal pain by redistributing pain from the metatarsal.
Yep. So general purpose.
It is distribute pressure relief.
That's an easy one. And function.
Deformity.
More proper alignment because it's out of alignment. So you're putting it back into the alignment with this to get it off of there, and also protecting against additional injuries. Because if you're going to get too much pressure on that, you're going to end up with skin to break down. Okay? Makes sense? Last one, rocker bar for our rocker.
Patients who have difficulty with terminal facts, and then it relieves the pressure from the metatarsal hip as well.
Okay? So general purpose?
General purpose.
Kind of a couple in there.
You could argue probably all of them.
Almost all of them. Definitely distributing the pressure relief because it says that. But then also it talks about, did it talk about stance phase? Yes, stance phase. So that's going to help improve their function, right? Yes. Okay, improve their gait and stuff. And the function would obviously be, facilitating motion. Okay. Again, preventing deformity, proper alignment, that kind of stuff. All right. Don't get involved in a lot of other stuff. Look at score builders and know what you need to know. Don't get into a lot of extra stuff. Okay, that is going to mess you up big time. Does this help?
Yes.
Do all of these help? Short, simple, one-word answer. Sweet, you won't remember long sentences. You will not remember that. Okay, and then relate it back to what's the purpose of it. because the question is not going to be saying, tell me what a hello thing is. The question is going to be, you have a patient who just recently went through or recently had a C3 fracture. What kind of orthotic would you use to stabilize their neck? And you're going to be like, stabilize? Can't move it? Halo. Okay? So that's where you've got to just keep it short and sweet, or you are not going to remember those. Do you guys want to take lunch break or get into Goni stuff a little bit? Lunch break? Okay. Sounds good to me. No, we didn't get to Goni. We're going to start here. All right. So come back at like 5 of 12. How's that sound? All right. I'm going to go get Chris and tell him to shut stuff off. Oh, I got to stay away from you. I can't hug you. I can't hug you. We're on break till like 11:55. Okay. Take this off before I said anything. Oh, look at that green.
Probably got it.
Huh? Green.
They're probably still getting it. Okay. That was a good one. Okay. Thank you.